How to treat lower back pain at home. Lower back pain is among the most common health complaints affecting millions worldwide. It can result from various factors, including poor posture, muscle strain, injury, or underlying medical conditions. While severe or chronic back pain may require professional medical attention, many cases can be effectively managed at home. Here are practical and proven methods to treat lower back pain from the comfort of your home. 1. Apply heat or cold therapy. Cold therapy. During the initial stages of back pain, typically within the first 24–48 hours, ice packs can help reduce inflammation and numb the affected area. Wrap an ice pack or a bag of frozen vegetables in a towel and use it on the lower back for 15–20 minutes. Repeat this several times a day. Heat therapy. After the acute inflammation subsides, switch to heat therapy to relax tense muscles and improve blood flow. Use a heating pad, hot water bottle, or warm bath. Apply heat for 20–30 minutes as needed. 2. Practice gentle stretches and exercises. Staying active is crucial for managing lower back pain. Gentle stretches and exercises can help relieve tension, improve flexibility, and strengthen the muscles supporting the spine. Try these simple moves. 1. Cat-cow stretch. Start on all fours. Alternate between arching your back, cow, and rounding it, cat. Repeat 8–10 times. 2. Child's pose. Sit back on your heels with your arms stretched forward and your forehead resting on the floor. Hold for 20–30 seconds. 3. Knee to chest stretch. Lie on your back, bring one knee to your chest, and hold for 15–20 seconds. Switch legs and repeat. 4. Pelvic tilt. Lie on your back with your knees bent. Tighten your abdominal muscles and flatten your back against the floor. Hold for 5 seconds, then release. Repeat 10–15 times. 3. Maintain good posture. Poor posture can exacerbate lower back pain. Be mindful of your posture throughout the day, especially when sitting or standing for extended periods. Follow these tips. 1. Sit with your back straight, shoulders relaxed, and both feet flat on the floor. 2. Use a lumbar roll or cushion to support the natural curve of your lower back. 3. Avoid slouching or leaning forward excessively. 4. If you work at a desk, adjust your chair and computer screen to prevent strain on your back and neck. 4. Use over-the-counter pain relievers. Non-prescription medications such as ibuprofen, Advil, or acetaminophen, Tylenol, can help reduce pain and inflammation. Follow the recommended dosage on the label and consult a healthcare provider if you have any concerns or pre-existing conditions. 5. Try relaxation techniques. Stress and tension can contribute to muscle tightness and worsen back pain. Incorporating relaxation techniques into your daily routine can help alleviate discomfort. 1. Deep breathing. Practice deep breaths to calm your mind and relax your muscles. 2. Meditation. Use guided meditation apps or videos to reduce stress and promote relaxation. 3. Yoga. Gentle yoga routines designed for back pain can help release tension and improve flexibility. 6. Improve sleep position. Your sleeping position plays a significant role in managing lower back pain. Try these tips for a more comfortable and supportive sleep. 1. Sleep on your side with a pillow between your knees to align your spine. 2. If you sleep on your back, place a pillow under your knees to reduce pressure on your lower back. 3. Avoid sleeping on your stomach, as it can strain your neck and lower back. 4. Invest in a medium firm mattress that provides adequate support. 7. Incorporate anti-inflammatory foods. A diet rich in anti-inflammatory foods can support recovery and reduce back pain. Include these in your meals. 1. Fatty fish like salmon or mackerel. 2. Leafy greens such as spinach and kale. 3. Berries, including blueberries and strawberries. 4. Nuts and seeds, particularly almonds and flax seeds. 5. Spices like turmeric and ginger. Stay hydrated and limit your processed foods, sugar, and refined carbs intake. 8. Engage in low-impact activities. It is crucial to stay active without overexerting yourself. Low-impact activities like walking, swimming, or cycling can help maintain mobility and prevent stiffness without worsening pain. 9. Use essential oils and topical remedies. Some essential oils and topical creams can provide relief from lower back pain. 1. Peppermint oil. Its cooling effect can soothe sore muscles. 2. Lavender oil. Known for its relaxing properties, lavender can help ease tension. 3. Topical creams. Look for creams containing menthol or capsaicin for temporary pain relief. 10. When to seek professional help. While most cases of lower back pain improve with home care, consult a healthcare professional if 1. Pain persists for more than 2 weeks. 2. You experience numbness, tingling, or weakness in your legs. 3. The pain is severe and doesn't improve with rest or treatment. 4. You have a history of osteoporosis, cancer, or unexplained weight loss. Conclusion: lower back pain can be frustrating, but you can effectively manage and alleviate it at home with the right approach. You can ease discomfort and support your recovery by combining heat or cold therapy, gentle stretches, proper posture, and other practical tips. However, always listen to your body and consult a professional if needed. A proactive and mindful approach to your health can help you regain mobility and improve your quality of life. Loudspeaker, let's connect. Share your experience in the comments. Thumbs up like this video and share it with someone looking to like it.